Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. Today, I am back with the ABCs of concussion, and today we're talking about the letter I. Before we get into that, I just wanted to quickly remind you that if you like what you hear on the show, I do all of the recording, editing, posting, and if you would like to help support any of that on the show, in the show notes, there's a link to buy me a coffee. So buy me a virtual coffee that doesn't actually buy me a real coffee, which is okay because I can fall asleep while drinking a real coffee. So any amount is greatly appreciated, helps me with all of my time that I spend on this show. And I do love it, even though I don't have any sponsors yet at this point. So thanks for being here with me and for listening all the time. So again, buy me a coffee if you'd like to support the show. You can always get a copy of one of my books. If you're local, I can get one to you in person or on Amazon. Both my TBI recovery story and my migraine help from Unicorn Nurse Practitioner are both still on there. The TBI recovery is also on barnesandnoble.com as well as Audible. So lots of places you can hear my story about my TBI recovery for the first year of recovery, at least. At some point, I might make a second edition of that one to go from that 1 year and beyond. So there is that. So back to today's show, letter I again. So all of these topics are related to concussion / TBI in some aspect, all starting with the letter I. So the first word is incidence. Incidence is just talking about how many concussions we see every year. So it's estimated that there's somewhere between 2.8 and 3.8 million concussions occurring annually in the United States. And it's estimated because we only know so much. We still believe that it's underreported. We still believe that it's not diagnosed appropriately. It's getting better, but it's not as good as it potentially could be. Half of all of those concussions are sports related. And in the recent years, there have been several studies that have published that 40 to 50% of patients are not recovered at 3 months, which was previously not identified. They used to say that within 3 to 4 weeks, you were back to normal. And if you weren't, then that could only have happened with a severe TBI, such as when people lose consciousness, have a bleed in their brain, and they're in a coma. But we know that that's not the case with most patients. So up to half of those patients still are not recovered at 3 months. And I did talk about a little bit more with those numbers in previous letters as well. So we know more now. And according to the CDC Heads Up program, their research shows that 7 out of every 10 emergency room visits for sports and recreation related TBIs are in ages 17 and under. So a large portion of those, the majority of those ED visits are for kids under the age of 17. So lots of sports related concussions. The top sports with the highest rates of concussion, they split them out between boys and girls. So even it's the same sport, they split it out between boys and girls to show what those top 10 are. So boys tackle football was number 1, girls soccer number 2, boys lacrosse number 3, boys ice hockey number 4, boys wrestling number 5, girls lacrosse number 6, girls field hockey number 7, girls basketball number 8, boys soccer number 9, and girls softball number 10. I remember playing softball as a kid and thinking that there's no way that I was going to end up with a concussion because it's not a contact sport. But guess what? You can come in contact with the ball. You can come in contact with other players if you're both going for the same ball and you don't stop in time. So yes, even with things like softball, which are not typically thought of as contact sports, there's still a high number of concussions that can occur. There are other studies outside the US, such as in Britain and Australia, that have proven the mechanism of injury appears to differ in the same sport between men and women. And I did talk about this a little bit in my gender difference episode that I did probably about a year ago now. So the prevention strategies likely need to be different as they identified in their research as well, because the mechanism of injury is different. One of the things that I remember seeing in the research previously when I was doing the gender difference episode was that females tend to have less strong neck muscles. So that can lead to more whiplash injuries. So that's just one of the multitude of differences we can see between the genders having the concussions occur. So again, treatment and recovery is probably going to look different also. So we need a lot, there's a lot that we can do in research, honestly. Most of the research at this point in the US, at least that has been done, has been on males in athletics. So we can't really translate that information to women, to non-athletic related concussions, because that's the only population that has been studied. So lots to come on that, but still that incidence number is kind of questionable because we don't know exactly how many are out there. Intimacy is the next I letter. And yes, I'm going out with a bang on this one. I'm just going to jump right into it. There can be many different changes within sexual behavior after a concussion and brain injury. Some people, about half, can see a reduced libido. Others will have an increased libido. Some have no change. For men, erectile problems happen in about 40 to 60%. And some of that can be either temporary or permanent. Inability to orgasm can be seen in up to 40% of both men and women. And reduced frequency of sex may be related to disability, depression, the relationship breakup, or sexual problems such as we just talked about. Other factors that come into play when we're talking about intimacy after a concussion: emotions. There can be a lot of depression, anxiety, stress, which all reduce sex drive. Medications can dampen libido. Injuries can affect the functioning if there's are structural injuries. Relationship breakdown, as I mentioned. Not everyone makes it through. And I know we talked about this before with relationships and how many marriages end after concussion and relationships break up because it's a stressful time and not everybody can handle it. Any prior sexual difficulties may worsen after a concussion. And then again, just because of how you feel and how confident you feel, that reduced confidence and attractiveness can affect your sex life as well. And then sometimes we see inappropriate sexual behavior occurring. So hypersexuality, masturbating in front of others. It's not a common thing, but it can happen and it's something to watch for. Reproductive changes can occur. We talked about the changes in the sex hormones before. So women can now find it difficult getting pregnant. Changes in their periods, as we've already discussed, it can make their periods very irregular. It can lead to early menopause in some women. So lots of reproductive changes can happen. And then we talked about the partner ending up in the caregiver role back in letter C. Taking on that different relationship role can change the feelings of intimacy in a relationship too, because now you're doing all of this caregiving, and depending on the level of severity of the person that had the head injury, they might need more caregiving than others. And it's at that point where that line gets a little blurry between romantic partner and caregiver. And sometimes that puts a lot of strain on a relationship as well. Struggles with sex as well as finances, communication can all affect intimacy, just as the sex part of the intimacy. If you're not communicating as well, if you're not keeping up with that other person, that makes a difference in how that intimacy looks in your relationship also. And it is important to maintain the romantic relationship regardless of other changes in the relationship. So things that you can do to kind of work on this. It's important to schedule opportunities away from other responsibilities. It gets really crazy and finances get tight and crummy, and that makes a difference as well. But it's really important to schedule those times where you purposely make time for each other to try to get back to that relationship part of it, that intimate part of the relationship. Whether or not you're having sex, it's another part of just getting in there and being together. Schedule date nights. Doesn't have to be a big thing, just a night to pack a picnic lunch and go eat at a park. Do something together where it's just you two and you're not worrying about other stressors. Thank each other for their assistance in the recovery. A little acknowledgement can go a long way. So just that communication piece, acknowledging, affirming the other person, and really showing that you appreciate them. And just communication in general, really, really important. If you're struggling with all of those, you can't do these things on your own. Couples therapy can be incredibly helpful as you kind of muddle through these new roles. And again, that brain functioning can be different. So a couples therapist can really help you work through a lot of these concerns so that you can get back to more normalcy in your relationship as well. The next I to talk about is independence. And independence has kind of popped up a little bit with all of the letters that we've talked about. But thinking about independence, the amount of assistance needed will depend obviously on the severity of the injury. So if somebody has a more mild injury, they're not going to need as much assistance, maybe some reminders, remembering things, versus somebody who had a severe injury, who has physical limitations and significant cognitive deficits. It's going to be quite a difference in what kind of assistance is needed. Likely there's going to be more assistance needed initially when the acute phase of recovery is happening. And then as the brain recovers, the individual should be able to regain some independence through improved function as they're working with PT, OT, speech, all the different treatments to get them better. That independence should come back little by little. It doesn't mean they're going to be out driving and doing their own things if they had a really severe head injury, but just little by little acknowledging that there are some things that they can do that they couldn't do before. We need to focus on that gradual return to daily routines, whether that be work or school, and seeing how much independence can be there. Maybe you might need have more independence when you go to work or school, but when you come home after a long day and your brain is already kind of turning off a little bit, that's when some of that assistance might be needed. So more assistance might be needed at different times of the day, even. Those within individuals might need assistive devices or adapted environments in order to get them back to either that work or school environment, trying to get them back again in as much independence as possible with use of those assistive devices and adapted environments. That daily schedule might need to be altered. In order to be more independent, you might have to alter that day so that you don't try to do everything all at once. I learned the hard way that if I try to do too many activities all in one day, I was definitely going to need assistance because by the end of the day, I was shot. There was no way that I could also do dinner. So you might need more assistance as you run out of battery. You might need to schedule things on different days. Don't schedule all of your appointments on one day. Schedule a couple at a time. I know it can be kind of crazy to drive to places multiple times. Spreading them out a little bit will make it so that you can do all of those things. You don't have to do them all in one day. Just do all of those things at different times. Otherwise, you might need a little bit more assistance as you're going through because you run out of battery. Some individuals require ongoing support and adjustments to lifestyle, which can include continued therapy, medications, other resources, support groups, and those things can go on and on for an indefinite period. There is no magic 8 ball that can tell us how long it will take or who will be affected more than others. There are risk factors that can increase your recovery time. But even with those risk factors, no two concussions will respond the same. As we've said before, if you've seen one concussion, that means you've seen one concussion because not everybody responds the same. And I've had patients come through my clinic now that some of them have had multiple risk factors for leading them to a prolonged recovery, and they're recovering really well. And other people, this is their first concussion. They've never had any other head injuries before, and they're not recovering very well. So even though there are those risk factors that can kind of say what your recovery might look like, it's not set in stone. There is no rule of thumb for it. Everybody's going to respond a little bit differently. And that's why we have to take it such an individualized approach in that recovery. And that could have been another I. I don't think I got that one in there. But the next I then is isolation. And this one can stem from some of those intimacy partners and independence parts. This can be taken a couple ways when we talk about isolation, though. So years ago, when they first talked about concussion recovery, they used to say, kind of isolate yourself in a dark room, complete brain and physical rest until your symptoms subsided. But we know now that this is not the current recommendation because that actually, if you stay in that dark room by yourself, and you're not doing any kind of activity, that will actually slow down your recovery. We know that now. So now that we know better, we're trying to do better, right? So social isolation, on the other hand, can be very debilitating, and that sometimes comes from the individual themselves because people may choose to isolate because of embarrassment due to their ongoing symptoms, such as with speech difficulties or memory impairment. If they can't really participate in the social situation as much, they sometimes feel like they don't want to be in that social situation because it is very awkward and embarrassing. They may choose to isolate because of overstimulation. If they can't tolerate busy activities or being around others in social situations, they again choose not to do it because they can't tolerate. Fatigue may make it difficult to be in those social situations as well. So that might be another reason why they're just kind of backing off of those activities. They also might choose to isolate because they feel like others do not understand their condition. And that's a very common problem that people report, is that they just don't think that others understand. And to be honest, until you've been in that situation, you can't really understand what it's like to be a person living with a brain injury. Um, Depression can often lead to further isolation with this. So if you are not going to those activities because of any of the reasons that I just listed, you start to feel down because you're not with your friends. You're not out doing the things that everybody's doing. That FOMO, fear of missing out, is a real thing in the brain injury world. And then that starts to lead to depression, which makes you isolate even further. So it's kind of a downward spiral at that point. So how do you manage this isolation part of it? How do you prevent people from going into a dark hole and just living there? Communicate with your friends and family. So if you are the individual with the brain injury, communicate with your friends and family so that they don't misunderstand. They won't know your struggles until you're talking about them. And sometimes they still won't understand, but just that little bit of communication, trying to help them understand where you're at, will increase the chances that they understand. They might mistakenly think that you've already gotten back to normal life. And I had several friends who are people that I don't see on a day-to-day basis, and they thought that I was getting back to more normal life because they could see me doing things. And yes, I might have been posting that I went to my kids' swim meet, but what you didn't see was that I was off in a corner of the school or hiding out in the car for a bit of time because it was too overstimulating to be inside, and I'd run inside, watch his race, and get the heck back out of there because it was too much. So just because you're going to those things doesn't mean you're fully invested in those activities either. So communication goes a long way for relationships, for whether it's an intimate relationship or a friend or family or work relationship, either communicating what those needs are, because people, as we've talked about this before, this is a very silent, it's a very hidden disability. People can't see it. So if you can't see it, you tend to not understand it. Again, as the person with the injury, ask for help. Explain what you need help with. If you can, sometimes you can't, but that may bring some of those people closer also. A lot of times people will say, well, call me if you need help, or let me know if you need something. And to be honest, sometimes as the individual, you don't know what you need. You don't know what you need help with. But on those times, on those occasions that you do know what you need, it's really important to bring in somebody that can help you. Ask for assistance. Let them know what you need, because 9 times out of 10, your friends are going to be very willing to come help you. They just need to know that you need the help. They can't help if they don't know what help you need. That can be with your romantic partner as well. If you're not telling them what you need, they won't know because they might think that you're okay otherwise. So unfortunately, some relationships, romantic or otherwise, might fade away over time because of that social disconnection. If you're not going to those activities, this is where that whole statement that you find out who your real friends are, because sometimes you do. And if people can't handle that, the fact that you need a different kind of social activity, that might be the end of some relationships. But you need to learn to be okay with it. There's another old adage that I've heard so many times, that people are in your life for a season, a reason, or a lifetime. And during these times when you have a traumatic brain injury that you're recovering from, that's a big life change. And that's when you really find out sometimes what role those people played in your lives. Are they going to be there forever? Were they there for a reason? Do you meet somebody along the time in your recovery that's there for a reason or a season? And not everybody that's in your life at all times will always be there. And we have to be okay with that. But it does lead to some additional stress when we're talking about this potential for isolation and depression and things like that as somebody's trying to heal. The big thing with this is asking for support. If you don't feel like talking with your friends and family, which I highly recommend that you do if you're the person with the brain injury, but if you don't feel like doing that, seek other support. Sometimes the support group is exactly where you need to be, where you can be surrounded by others who do understand exactly what you're going through, and they can be a great outlet, whether this is in person or virtual. There are many organizations out there that do virtual support groups as well. Organizations like Headway, Hope Survives, and Love Your Brain all have virtual options to connect with others across the country or even across the globe. And while sometimes you might be hesitant to do that, it's really important to connect with those people that do understand. And I kind kind of got the importance of that when I went out to the National Brain Injury Conference in DC back in March of this year, because I was surrounded by other people who had been in similar situations. Most of the people that were out there were recovering to some aspect from a brain injury. And it's so affirming to be around other people who've been in your shoes. They've had those symptoms. They've had the frustrations of not getting the diagnosis appropriately or getting the treatment. And we were able to bounce ideas off of each other of different treatments that we had undergone. So for some people, it was learning opportunity that there are other things that they could try to get better. So that's where it's really important to kind of connect with those people that have been in the same situation as you. So then the next I is identity. And this one is a big one that I struggled with too. So you when you go through the recovery process from a TBI, you often feel like a whole different person. And I've had patients tell me that many times as they've come in to see me. They feel like a new person. They want to feel like a different person. However they want to state it, they just don't feel like they are themselves. And I felt that as well. So I definitely can relate on this aspect too. So many parts of your identity change: your personality, your behavior, that can all affect your sense of humor, how you interpret the world around you. Cognitive changes can affect how you interpret the world around you, how you express yourself, whether you can get back to the same job or any job after your injury, how you interact with others in your world, how you have physical changes that may affect how you participate in work or enjoyable activities like exercise or hobbies. All of those things can change, and those are all parts of your identity. And this is one thing that I struggled with a little bit, because I never knew how much I clung to my title of nurse practitioner until I couldn't do it. And that was a huge part of my identity that was not accessible to me anymore. And that was a really difficult thing to deal with. It can be incredibly difficult to adjust and accept these changes, especially early on when you want to be continuing to improve. So you don't want to be okay with that new set of norms because you don't want it to be the new norm. But this is where some of that grief comes in that we talked about back in the letter G, that loss of sense of self. So often people are left trying to figure out who they are. Sometimes this is a blessing in disguise because you can kind of look at your priorities and think, what do I want to gain out of this? Do I really want to go back to what I was doing? I couldn't work as a nurse practitioner for nearly 2 years. And this was a huge blow to my identity. I didn't realize, again, like I said, I didn't realize how much I relied on my career to identify who I was until I couldn't do it. And I know that I'm not alone in saying that, because I've had so many other people that I've connected with on their journeys that have said the same thing, that they really didn't realize how much they identified with that, and they really felt like they were a different person. So, having gone through the whole acceptance piece of things, I often refer to my post-injury self now as the new me. I've started to use the term Mandi 2.0 because of all the changes. And I can't necessarily say that all of them are upgrades. Like with your electronic devices, you upgrade to a new point, whatever. But some of them definitely are upgrades. All of this knowledge that I've gained about concussion and TBI that I can now share with other people and help other people have a better experience, hopefully, than I did as I was going through. That's definitely made me a better provider, a better person in general in society. So there are things that are definitely better than they were prior to my injury. So how best do you manage this problem with identity, with losing your sense of self, with losing who you are? And if you are the caregiver, if you are the loved one of the person that has the injury and you're watching somebody go through this, I know it's very difficult on you as well, because my husband has told me that he had a very difficult time watching me kind of struggle with that identity part of things. So how can we manage this? It requires a lot of patience, a lot of kindness to yourself, to your loved one. Give your family member, your loved one, that grace that you would give anyone else who's recovering from something. So we are all our biggest, worst critics all the time. But sometimes our family and friends, those close people to us, can also be really strong critics if they really don't understand what's going on. So that's why I'm doing these shows, is to try to help you understand what happens in the brain of somebody who's got an injury like this, so that you know how to help support them. If you are the caregiver, if you're the supporter, if you're the healthcare provider taking care of them, just learning a few extra things that you didn't know before as it relates to concussion and brain injury. So again, as the person with the individual, it's really important to talk to your family and friends about how you're feeling so that they can understand what you're going through. And I know I've said this multiple times in the show already, and I kind of probably sound like a broken record, but it's really important to communicate that so that your family and friends understand what's going on in your brain and how they can best help support you. They might have some creative ideas on how to incorporate some of the things you used to do in your current life with your current abilities. So getting support from a counselor might also be helpful, especially someone who has experience working with those with brain injury. That's going to be the most understanding counselor that you can find. I tried a few, and some of them had no idea what happens with brain injury, and they were so not helpful for me. So I had to keep trying to find one that was. So it's really important to find that counselor, that therapist who has worked with people that have brain injury. They understand the intricacies of it, and they can help you get to the best version of you. Um, it might be time to start looking at a new hobby or skill. Sometimes with brain injury, we actually lose uh, not just abilities to do things, but we lose interest in doing the things that we used to do. I've seen that in my stroke patients before, and when I was dealing with the stroke population on a regular basis. Those brain injuries can cause changes in your brain so that you might not actually enjoy doing the things that you did before. Even though you want to get back to those things, you can't have that same enjoyment. So it might be time to pick up a new hobby or skill because you might find something now that you enjoy that you didn't before. So you might find something completely new. And it's time to identify your personal values. So sometimes things we can no longer do, or at least no longer do to the um, same ability, maybe they don't represent the values or the feelings that we have. And we can find something else that helps us portray that same value in a different way, but in something that we can actually tolerate. So again, finding a new hobby or skill that matches up with what you currently can do. And again, this might require some help from a loved one or even a vocational counselor on trying to see what can you do that can bring you the same kind of value that you had before. It's sometimes hard to identify right away that what you want to do, and it's hard to see these changes initially, but things will get better over time, even if you don't get back to the way you were before. Sometimes you realize that you don't really want to go back to that. So you still want to have the same impact, but you don't want to have that same level of work you put in before. So for example, I'll tell you a little bit from my experience. Um, After I was going through this whole recovery process, I had I think it's kind of one day, kind of happened really quickly that I had this aha moment. I was working, looking back before the injury, I was working full time. I had a couple part-time gigs. I had my podcast, my kids. I was training for a marathon. I was busy all the time. I had no idea how to relax. I had no idea how to just kind of let go and unwind. That was not a thing that I did. Even going on vacations, I had everything planned out very carefully so that we had something to do every day. And there was never a rest day during vacation because I didn't want any wasted time, right? So as I was going through my recovery, I finally realized that I don't want to go back to that level of busy really ever. So I don't want to be that busy of a person. I wanted to be able to be a nurse practitioner again. And while the setting is different now than it was before, um, and my area of focus is slightly different, I am back, even if it is still just part-time right now. So I was always working in the hospital before. Yes, I at some points I did a combination of hospital and clinic, but hospital was always my favorite. I loved that rush. I loved the speed of things. I loved the acuity of the people that I was taking care of. I love taking care of those really sick patients and helping them and seeing that benefit. I think that kind of goes back to when I was a kid. One of my first jobs, my mom and I worked as a janitor in our church, and I loved vacuuming the stairs. And you guys are going to think I'm a total freak for this, but I loved vacuuming the stairs because I love that satisfying sound of all of the dirt and rocks and everything that were getting picked up off of these stairs. And I think that's what translated to me working so much in the hospital and loving that because you could take this person that was so critically ill. They were in ICU on a ventilator, all the things. And by the time they discharged from the hospital, they were not in that same position. They were much cleaner, per se. So getting them through that really acute phase really was my passion. I loved it. And I never thought I was going to do anything other than work in the hospital. But when I tried to go back, it was way too overstimulated, couldn't be done. So now I work in the clinic where I didn't think I would ever find enough passion, but I am just as passionate, if not more, about the things I do now in clinic as I was with the things I did in hospital. So I do have that value that looks a little bit different. It's okay. I'm rolling with it because right now I really love what I'm doing. So encourage you as a person with a brain injury, really try hard to find something else that can bring you that same value, bring you that same satisfaction, even if you can't get back to that thing that you were doing before. Sometimes it's okay that you don't get back to it. And we kind of always say in our family that things happen for a reason. And sometimes you can't see that reason right away. Sometimes you never really can see the reason, but keep pushing forward, because just wallowing on the past is not going to help you heal. That actually slows things down. So look for the positive. Take the time to grieve that loss of yourself, but then find something new in yourself to keep you going. Next I letter then is insomnia. Again, something that happens very frequently with the concussion population. I hear it all the time with my patients coming in day after day. It is, again, one of the more common symptoms after concussion. It can occur in up to 50% of all of the individuals that experience concussion. It can be caused by damage to the structures involved in sleep regulation, changes in neurotransmitters that affect your sleep, hormone imbalances, anxiety or stress. All of those can make it difficult for you to fall asleep and stay asleep at night. So what does it look like? It can be just that difficulty falling asleep. It can be waking up frequently with or without difficulty, going back to sleep, feeling not rested when you wake up. It can mean daytime fatigue, difficulty concentrating because of that lack of sleep. So any of these things can be related to insomnia. Not everybody knows what insomnia is. It's just when you're not getting that good sleep on a regular basis and there's something preventing you from doing it. Sleep is when our brain heals the most. So it is incredibly important for us to get good sleep. So, but the thing I like to try to describe to people all the time, and I've said this to many patients and their caregivers, think of the movie Inside Out. If you've seen that cartoon movie Inside Out, if you haven't seen it, I highly encourage you to watch it, even if you don't have children. Find some excuse to watch this movie because it's really cute and it really helps explain what's going on with your emotions. So it's a movie about emotions, essentially. So think of that movie Inside Out. If you've seen it, you'll understand what I'm talking about. At night, when those marbles are being processed, when they do the little lever and the marbles get filed where they're supposed to go. Some of them went to short-term memory, some went to long-term memory, and some were discarded as if because they were deemed unimportant. So they didn't need to be filed into memory. This is why we can have increased memory troubles if we're not getting good sleep, because your memories aren't getting filed appropriately. Those marbles aren't going where they're supposed to go. That long-term memory can't be filed correctly if your brain doesn't have time to process those memories. Sleep is also when most of the toxins are cleaned out of our brain. So again, if we're not getting good sleep, more neurotoxins are building up and it's causing more inflammation in your brain, more difficulty remembering things. So we really need to get rid of all those waste products at night so that your brain can think more clearly, literally during the day. So how do we manage insomnia? Some of the first things I like to talk about with people are the non-medication things, because I personally am very sensitive to side effects. And I know a lot of my patients that have come through my office have also been very sensitive to side effects. So we try to talk about lifestyle things first before we jump to medications. Now, that's not saying that medications aren't important, but lifestyle changes can sometimes make a bigger difference than the medication side of things. So sleep hygiene is probably the biggest thing that we can talk about. Sleep hygiene, when you think of hygiene, you think of cleaning yourself, right? Well, think of clean sleep. So the best things that you can do to get good sleep are go to sleep and wake up at the same time, regardless of the day of week. I understand sometimes this can't happen if you've got a change in your schedules and you work different shifts and whatever, but try as much as possible to go to sleep and wake up at the same time every day, regardless of that day of the week. Create a relaxing bedtime routine. This might include drinking a sleepy time tea. I know there's a company now that does like a melatonin hot chocolate. So drinking those teas and hot chocolates, they're magnesium hot chocolates, sorry, that's what it was. All of those different things that can help you get sleepy at night, those are good options to look at. A short massage, whether you're massaging your own shoulders or arms or legs, whatever, or you have a partner that can do that for you. Taking a warm bath, if you can get in and out of that bathtub. Using essential oils. Lavender is great for sleep. There are others. Also, I can't think of them off the top of my head. I didn't write them down. But there are other essential oils that can help with calming and relaxation as well. Things to avoid before you go to bed. Avoid caffeine and alcohol. Those will both be stimulants that will make it more difficult for you to fall asleep. And avoid the TV or the phone right before you go to bed. They say at least an hour, because that blue light can actually mess up with your natural melatonin production, your natural sleep cycle, and it makes it more difficult for you to fall asleep and stay asleep if you're on your TV and phone right before you go to bed. CBT, cognitive behavioral therapy. This is therapy that focuses specifically on the negative thoughts and behaviors that can cause anxiety when you're trying to sleep. So trying to get rid of those things that are making you anxious before you fall to sleep at night so that you can get to sleep. And then again, medications. Medications in some cases might be needed, such as sedatives or antidepressants. I prefer to look at more natural things like melatonin. It's a natural hormone that's created in our bodies. And there are some that are under the tongue melts or chews. Those tend to work better, get in your system better, and you don't need as high of doses. But you do need to be careful. There are some reports that say that long-term use of melatonin can be harmful, especially at high doses. And what is a high dose? Really 10 milligrams or more. So if you are regularly taking 10 milligrams of melatonin, you're essentially shutting down your body's own production of melatonin, and it will make it difficult for you to get to sleep on more than that. So you really shouldn't be taking that on a regular basis. 1, 2, 2.5, 5 milligrams are okay. There's not been any bad effects really shown with those long-term that I've found so far. So sticking with those lower doses is better. And again, if you can get the one that melts under your tongue or the sometimes the gummies of it, those you don't need as much because it gets into your system faster than a tablet does, and that works a little bit better with a lower dose. Some of the medications can be habit forming and some can come with a lot of side effects again, but they can be very beneficial in the first 3 to 6 months. The big thing is making sure that you get enough sleep and you allow your brain to heal. So if you're not getting that good sleep, that's where we're really going to run into problems. So things like Ambien might be necessary for that 3 to 6 month time period, sometimes longer, but sometimes that's all you need is just that first little kick to help you get better. Insomnia is not the only sleep disorder that can be seen after TBI, so I just wanted to take a quick moment to identify that as well. People can also experience sleep apnea, narcolepsy, falling asleep when they shouldn't be, sleep-related movement disorders. So any of those, including insomnia, may need to be evaluated by a sleep specialist to get those diagnosed and managed. The next I is injury, and this one should kind of go without saying that a concussion is a brain injury. I know I've said it multiple times, but not everybody seems to still understand this. So it is still not common knowledge that a concussion is a mild brain injury. And the term mild is only considering the fact that you didn't have a bleed or a period of unconsciousness. It is not mild in the severity of symptoms. Even those with a diagnosis of a, quote, mild TBI can still have severe life-altering symptoms. And again, it does not require hitting your head. I've said this so many times, but I'm going to say it again. It does not require hitting your head. Many people experience concussion due to the force of the movement to the brain within their skull. Such as that with what we call a contra coup injury. So you have an injury in the initial direction of the force. So think about if you get a hit from behind in a car accident, somebody rear ends you, your head first is going to go backwards because of the pressure coming from back. So that's the coup injury. You get your brain sloshing backwards. And then when you stop, that momentum forces you the other direction. So that's the contra coup. You get the injury on the opposite side. So we do see injury on both sides of the brain because of this. Blast injuries are another big one. So in the military, if one of our military personnel undergoes a blast injury, it's essentially like 5 or 6 concussions occurring simultaneously without any blunt force trauma to the head. So that just the massive vibrations from that blast can have the effects of what looks like 5 to 6 concussions all at the same time. So it really makes it more clear why our military personnel that are coming back are having these concussions, why they have so many things that are damaged to their brain, because they had multiple concussions at the same time. So there's researchers are working on a new subset of levels to try to talk about the level of injury, the mild, moderate, severe. Those are the terms we've used forever. And again, they don't often match up with the symptoms that people experience. The only way you are considered in the severe category is if you had a loss of consciousness and you were in a coma and you had a bleed. Moderate, there's a loss of consciousness that's brief, but again, if you have a mild concussion, what's something currently considered a mild concussion, you didn't have a bleed, but it does not mean that your symptoms are going to go away completely. People do not recover quite as well from the mild concussion as we used to think. So there are groups that are trying to come up with new terminology because these mild, moderate, severe terms do not match with those symptoms. So it is an injury. It is something to think about. And there are multiple ways that the injuries can happen, and we need to look at better ways to try to heal them. The last I letter that I want to talk about with you today is improvement, because this is something that will 100% occur after a brain injury for all individuals who survive a TBI. But the rate of improvement differs for everyone. This is, again, where I can see two TBI patients back to back in clinic, and their recovery is going to look very, very different. So as we've said, there are risk factors that can increase that recovery time, but they are not guaranteed. Like I mentioned, I've seen so many different varieties of recovery. And the only thing that I can say for certain is that recovery takes time. I wish, even for my own sake, that I could tell patients how long they should expect to be in recovery, but there are no guarantees. So what I always tell them is that improvement will happen, no matter how slow. And when you find yourself at a plateau, it's time to look for a different healing strategy. So if you are the care provider, if you are the healthcare worker watching these patients, if they seem like they're at a plateau, this is not the time to tell them that this is what they're going to be for the rest of their life, because it's not. And I can tell you that because I still see people getting better. I met people at the conference in March that were 17 years out of their brain injury, and they were still seeing improvements. So when you find something new that trains your brain a different way, and you can start to get better again in a different way, there are many options for treatment. There will always be a provider out there who has new ideas that you haven't tried. So if you find yourself at a plateau and you have this provider that doesn't know any other options, look for somebody who does, because there will always be somebody out there. Don't stop looking for options. Don't sell yourself short. If you are the person with the injury, keep working on looking for other options. If you, again, as I mentioned, if you're the caregiver, if you're the healthcare provider, be open to those new options. Look for something to help your loved one, your person get better, because the improvements will come, but they might not be as dramatic as they were initially, but it's still something to pay attention to. Every time I see patients in clinic and they're starting to get better, we always celebrate that. Celebrate every little win. So those are my I letters for you today. I hope it's been a good episode. If you have thoughts on future letters, anything from J and above, go ahead and send me a message, and I'll try to incorporate those letters into the show. Again, why do I do the ABCs of concussion? Because it is not a well-known thing yet. There are still so many people who don't understand concussion, don't understand what happens with a brain injury. And as a provider, I'm trying to make the world a better place for people that go through this, because there are so many options for improvement, and we just need to be open to them. So thank you guys for listening, and I'll see you next time. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.